the World Economic Forum has released its outlook on the global agenda for 2015. Now, this in-depth report highlights the trends within as well as the challenges that countries and regions currently face around the world. I'm Onyi Sunday, and on today's show, we'll be discussing regional challenges and trends in West Africa, with a strong focus on the growing importance of health and healthcare in West African economies. Well, joining me in studio to share their insights on the topic are Dr. Sampson Parker. He's a Commissioner for Health, River State. I also have Dr. Andrew Nevin. He's the Head of Strategy Consulting for PwC Africa based in Lagos. And I also have Muntaqa Umar-Sadiq. He's the CEO, Private Sector Health Alliance of Nigeria. Gentlemen, welcome to the show.
Thank you. Great to be here.
Now, of course, when we talk about healthcare in West Africa, the first thing that comes to mind for everyone is the Ebola scourge. That just comes to mind. I mean, and of course, we cannot start a discussion in health without bringing up, the talk on the Ebola virus. Now, this virus is still underway in several countries in West Africa, ravaging most of these countries, and of course, threatening lives and the economy. And I'm going to start by saying, start with you, Dr. Parker. Now, what's your take really on how West Africa is handling or tackling this scourge?
I think we've taken up this challenge. We can't, there is no running away from it. It's here with us. In Liberia, in Sierra Leone, in Guinea, lately in Mali. We had something in Senegal. Then Nigeria, we had a massive scare, a huge scare in Lagos State and River State. But the good news is that Nigeria has been able to show that it can be handled. And within 3 months, we got it cleaned up here in Nigeria. And that gives all of us in West Africa the hope that even the one in Liberia, Sierra Leone, and Guinea, with the proper application of the strategies used here in Nigeria, we should be able to take care of it.
All right. Now, Dr. Nevin, let's look at this. We're talking about, he just said with the proper strategies, these countries can also tackle it just the way Nigeria did. I mean, why do you think the case in Liberia now is really making news? I mean, we're talking about sending volunteer workers to these countries. Are they doing something wrong? Are they not, employing the right strategy? What's your take?
Well, I mean, the reality is these are countries that are very poor, have very underdeveloped healthcare systems, underdeveloped public education, so it's hard to propagate the messages. So it's not a big surprise that once it got stuck in essentially in Liberia and Sierra Leone, it's become a huge problem. And the world has been slow, as we know, to mobilize, but I think now it's coming together. You look at the number of countries contributing, you look at the volunteers coming from Nigeria and elsewhere, so there's real progress. And I think that by the next year, we'll see this starting to be, beaten back. I think if you go back to the question for today on the program, with respect to the economy, how long will it take for Liberia and Sierra Leone and the other countries to bounce back economically from this? I think that's a very interesting question. I was at the top international hospital in Beijing during SARS, and in the case of China and Beijing, they bounced back very quickly, but they were at a very high state of development. I think it's going to take a lot of work by a lot of people to get Liberia and Sierra Leone back on the growth tracks they were on prior to this, because they were doing really, really well up until Ebola arrived.
Well, that's a very interesting point. We'll get back to that, but let's really take a look right now. I mean, it's one thing for us to, bring these economies back, to revive the economy, but we're talking about ensuring that we do not lose more lives. We're talking about the healthcare of these people at the moment. Now, Dr. Sadiq, let's take a look at what's really happening in these regions. What's your take really on how West Africa is handling it? I know Nigeria a few days ago did send about 250 volunteers. The African Union is also seeking about 1,000 volunteers in total from Africa to help in this region. He also said something important, the fact that he thinks it's a bit slow. The world is responding, slowly to this. Do you agree?
Well, I think that what Ebola has done really is to, in a sense, highlight the healthcare system more broadly. In most of these African countries that you've mentioned, we continue to have significant challenges, particularly around suboptimal health outcomes, poor quality of care, double disease burden, both communicable as well as non-communicable diseases. Now, what we have seen, using Nigeria as a case study, are a couple of things. I think the first important thing was the ability to forge partnerships. And when I say partnerships, I mean partnerships across all boards, from state to federal government, from the private sector to the public sector, from beneficiaries to government, from traditional leaders, religious leaders. That coalition and that sort of focus on delivery, I think, was key. I'll give a quick example. I lead the institution called the Private Sector Health Alliance of Nigeria, which is led by Alhaji Aliko Dangote, who has mobilized the resources to fund these volunteers and have gone on to other countries. What was interesting was that private sector capabilities, resources, and tools were used to address Ebola challenges, whether it is private sector techniques. So one of the first things that Lagos government did was to institutionalize something called an Ebola Operating Center, Emergency Operations Center, where they analyze data, they undertake all of the coordination and all of that. This is sort of a private sector tool. Other private sector capabilities, whether it is Chevron or ExxonMobil mobilizing resources to support the movement, or other FMCG companies bringing to bear their trucks to transport some of the health commodities and services. We saw these sorts of partnerships to play a role in addressing these issues. And I think that we are pleased that these approaches are being exported to some of these other countries to address the challenges.
What's your take on private sector partnership really in tackling this, where the private sector comes in? Because right now it's all about, we're all dealing with the governments, of these countries. What's your take really on the role of the private sector?
Well, at the end of the day, everything is a combination of the government and the private sector. I mean, and a large part of even publicly delivered healthcare is delivered by private companies, by private individuals. And I think that the logistics capabilities of the private companies are so much greater. So exactly as has been said, you need the private companies to set up the systems that are going to address it. So I don't think we should be afraid of that. And we're not going to get the healthcare we need, whether it's in Liberia or Nigeria, without the private sector right there.
It's a very interesting word you also mentioned, issue of logistics. You also mentioned that I remember when we had the first Ebola victim in Port Harcourt, you did say logistics. That's just the word that kept coming all the time. We need to round up these people. We need to get them. We need to locate them and all that. And that just goes further to say, that it goes beyond just the infrastructure we're talking about. I'm bringing this to you because whenever we talk about healthcare or healthcare delivery, let me stay with Nigeria. I'm not sure about the other countries. We tend to talk about, the governments tend to talk about the fact that there is a building. We're talking about the physical infrastructure, and we've built hospitals. We've built 3 hospitals. We've built 4 hospitals. Is it all about just having the physical infrastructure on ground? I mean, we had hospitals, and you just also mentioned that if not for logistics, we'll be nowhere. So tell me, when we talk about development in the health sector, is it just all about the physical infrastructure? Is it just all about providing these hospitals and the buildings, both in local government areas and in the cities, Dr. Parker?
Far from it, physical infrastructure. I have a challenge here because there are 2 areas, what the people want and what the government want to give. First, with the people want to see what the government is doing to develop confidence in the government. And so the physical structures must come in. So you must let them see that there are structures that symbolizes healthcare. I say symbolizes. But the main activity is the content, what goes on in there, what happens in there, and how can those activities be sustained? How can these things be sustained? That is where what my Sadiq talked about, private sector tool comes in. He calls it private sector tool because the tools are there, but the private sector tend to use it more often for profitability. The public sector do not think much about profitability in terms of naira, kobo, dollars, but all profitability is profitability in terms of maternal outcomes, infant health, maternal health outcomes. Those are the profits that you find in health. And so when you put together these things, like for instance, the private sector, before they come and say they bring in a physical infrastructure that is attractive to these people, they're thinking about the number of people that they're attracted to their health facilities. So you see, that is what happens even in the public sector. So I think that we need to put all the things together, the content, the strategy to contain these things. we'll come later to how it affected Ebola in Nigeria. Like he said, EOC centers. It happened here in Lagos. When they came to Port Harcourt, when it happened in Port Harcourt, we did the same thing. Probably a better center than the one that happened in Lagos, because we had to improve on that.
Okay.
Because the Lagos guys came and we improved on that.
We're definitely going to go into comparison later on, but let's just, we're going to say something, you're going to contribute to what he's just said.
Yes, I just wanted to build on what he said. Your question around infrastructure.
Yes.
I'd like to sort of add more color around it, because we're talking in terms of a health system, the building blocks of a health system.
Exactly.
There is a supply side as well as a demand side, right? So, and infrastructure means nothing if it doesn't have the health workers, the differentiators from your midwives to your community healthcare workers to your village healthcare workers. Infrastructure means nothing if you don't have the right data systems to inform planning and to improve quality service delivery. You also need a supply chain system. You need to get your drugs and services to facilities. But also on the flip side, on the demand side, we have seen many cases in Nigeria where you build a facility, you get health workers in there, but still women and children do not access those services. So there's a lot of work on the demand side around creating the sorts of awareness and education that women and children need to go to the facilities. There are issues around affordability, proximity, and a number of other issues. And so we need to think of infrastructure within this context. Now, it's sort of a double-edged sword, right? Because in terms of the political economy, we know that governments have the visibility and the short-term focus in terms of the symbolism, like you said, right, for political gains. But this must be done in the context of strengthening the healthcare system. So that balance, I think, is crucial. There's another important point. Most of the time when you speak to policymakers or government, they think in terms of inputs. So if you ask, what's your biggest achievement? They would say, I built 4 healthcare centers, like you said, or we did a number of trainings, or we procured 4 CT scans. When in reality, health sector performance should be measured in terms of the number of lives that you save, right? Because if you ask the Minister of Finance, she will talk to you about number of jobs created or contribution to GDP. In health, we are in the business of saving lives. It is estimated that every year, Nigeria loses 1 million women and children from preventable causes, 1 million. So imagine if we can anchor our vision, our target, to save 1 million lives a year, and we had a tool that could count the number of lives that we're saving as a result. I think that focus on health outcomes and not inputs is an important part of solving the sorts of challenges that we have here.
That's very interesting. Now, Dr. Nevin, in your opinion, what should be the focus the next time the government is talking about health infrastructure, or the next time anyone talks about health infrastructure? He's just created a picture to say it goes beyond just putting a building, a physical structure. I mean, the health system can run. You can actually save lives even without that standing. But let me just hear from you. What should we focus on the next time we talk about improving the health system in Nigeria or in West Africa?
Well, I think we need to start with the fact that the health system is the most complicated system in society. I mean, if you look at every country, the size of it, the amount of resources it takes, it's not a big surprise or a problem that's the largest system, because health's the most important thing we have. And I think we also need to start with the fact that it's incredibly complicated. It's not just complicated in Nigeria, it's complicated in the United States, it's complicated in the United Kingdom, it's complicated in Singapore, it's complicated in China, right? So for the health system to do what it's supposed to do, which is ultimately to deliver health, a lot of things have to happen. They have to happen in the private sector, they have to happen at the upper end, they have to training, etc. But let me put out one thing that I think is very valuable in Nigeria today, be valuable in many places, is a lot more public health education and focus on public health. And that's different than primary care health. This is getting out, educating people on issues around lifestyle. And particularly in this country, I mean, there's been huge progress made on communicable diseases. But now we have an explosion of diabetes, we have an explosion of renal failure, we have an explosion of cardiovascular disease. And obviously you can treat those once they come, but that's inefficient, and you're not going to get the healthiest population. So one investment among all of them that certainly makes sense is a much bigger investment in public health to address this epidemic of non-communicable diseases that's happening in this country.
Fantastic. Now, information, that's really key, I believe, in the health sector. I was going through an article today, going back to Ebola, and I believe the International SOS Organization has just created an app, really a free app for people to download and educate them more on Ebola. And this is really important because I remember during the outbreak in Rivers State, and we did go out to do a vox pop to just hear from people what they even know about Ebola. And you'd be surprised about what people had to say, like they're really in the dark. And the first question I asked was, do you have a phone? And he went, yes. Do you use the internet on the phone? Some said yes, because it's all about, just sending the messages. Because I'm like, it's just right in front of you. Now, do you think we're really using enough of what we have to disseminate information in the healthcare system? Are we really doing enough to educate people about what they need to know? Because information is key. You first of all have to understand what it is for you to even seek help in the first place. Do you think we're doing enough, really?
Yeah, we can't do enough. We can never do enough. For instance, the attitude of persons, of us living here, how many of us in a month budget for healthcare for his family? How many of us think of it as I have 10 naira and I'm going to put aside 1 naira for the health of this family? Hardly, it can get up to 10% of the population doing that. That is how much we care, how much we care about our healthcare. We just think it's just there. It's just there, it will just happen. Nobody gives a second thought to it until it happens. Everybody waits until it happens. That's why it's difficult to even key into the universal health coverage we're talking about.
So how do we equip them? How do we prepare them to be very aware and take it serious?
That is why I said that we cannot give enough information. We must keep educating them from the primary school level, education at the primary school level, from nursery even, to tell them the importance of healthcare, why they should continue to take care of. It used to happen when we were in those days in our days in primary school. They teach us hygiene is a topic in school, and we grow with it, what we should do and what we should not do. Let's take practical examples. You were there in the Ebola case, and we had to go to the 23 local government areas of Rivers State. The outbreak was in about just 3 local government areas: Port Harcourt, Lobiapo, and Equere or so, 3 of them. But we had to go to the other 20 local government areas to educate and to teach with them, have an interactive section with the persons to tell them. That should be a continuum. That is information and help in behavioral change. We coined up songs for the school children and all the rest. Education, education, education is the way to go at various levels. Great.
But Dr. Mukhtar, now that's just one way to go. That's him visiting about 23 local government areas. Of course, you won't do that every day, although you say yes, a continuum. But let's look at us. I mean, we have, we'll call it a better enlightened populace right now in Nigeria. I mean, almost everyone has a phone. We use it for one thing or the other. What do you think, let's really get practical, what do you think we have at our disposal that can be used to disseminate information to people on healthcare? Let's really get very practical. How do we bring the knowledge to their doorsteps? What can we do?
A couple of points there. I think first, there are social determinants to healthcare that we should sort of highlight. So some of the intersectoral relationships between education, health, hygiene, that really play an important role in advancing health outcomes. Having said that, I think for me, one of the biggest missed opportunities in improving healthcare delivery in Africa is leveraging innovation and technology to advance health outcomes. It is the most important, it's the single most important thing we can do to leapfrog our ability to meet our health goals. And so recently, a few days ago, the Private Sector Health Alliance of Nigeria launched a $1 million health innovation challenge to save 1 million lives, primarily to address the challenge that you just mentioned, right? So, for example, how can we leverage mobile health and apps to ensure that we play a role in data collection, in dissemination of information, in education? How can we use mobile technology to train our health workers in advances in healthcare? I think this is important. But I think more broadly, building on this, there are a number of other roles that, for example, the private sector can play to address this challenge. I think first has to do with advocacy. We know that we have, at least in the Private Sector Health Alliance, private sector leaders whose collective voices can help to give visibility to these sorts of issues and ensure that the sorts of education at that level, at the last mile, happens, right? Some of my board members, Mr. Jimovia, Alhaji Aliko Dangote, they have relationships at all levels that can be brought to bear to do this. The second really is around impact investments. And I'll tell you why. Healthcare is a very distorted market, right? So the kinds of technologies that you will need to ensure that people who have phones have access to the sort of materials that would help their lives, the investments for those sorts of innovations are not necessarily there. So one of the things that we do in the Alliance really is to mobilize private sector resources to spur these kinds of investments to address these sorts of challenges.
Oh, well, okay, go ahead, Dr. Nevin.
Well, I was just going to add, I think Sadiq is exactly right. I mean, I think if you go back to traditional way medicine is done, where someone comes and sees a patient, a doctor sees a patient, they have a handwritten record that goes in the records, see them 15 minutes, they have to come to the hospital, they have to come to the clinic. The point for Nigeria is to leapfrog all of that and use technologies. I mean, it is mathematically impossible to have the number of doctors, the number of nurses, the number of clinics to deliver healthcare to 170 million people or 250 million people in the future in that traditional way. So the point about the new technologies is Nigeria needs to, a little bit like the mobile phones in Africa, needs to get right out in front of that. And I think Sadiq's exactly right that that's not necessarily going to happen on its own. I mean, the venture capitalist investors want to see an entire ecosystem already working. That's not easy to put in front of that. Even the donor agencies, they're very difficult to actually put something at risk. So the point about having some people prepared to put up capital, to take some risks, to try some experiments. I mean, there's a woman in Lagos who's actually started a service totally off her own resources that sends SMS messages to pregnant mothers about child and maternal health and what to expect during pregnancy, and follows them through their pregnancy. What a fantastic initiative. But to get to scale, it's got to have people that are prepared to put some resources behind it and take some risks. And some of it's going to fail, but some of it's going to stick and make a huge difference. But just if you think a little bit, how is healthcare going to be delivered 15 or 20 years from now? If it's going to be successful in this country, it's going to be using a set of technologies and knowledge and connectivity that is, unimaginable right now.
Yeah. To add to what they've said, technology, wonderful. Practical exposure to what's happening as Commissioner for Health. I've tried a lot of other strategies, so many other strategies. Technology, yes. Phone business, getting the people to phone in, send SMS and all the rest, good. We brought in what we call the home-based healthcare. Home-based healthcare, we use the local health workers in every community, gotten from their communities, to wake up in the morning. Their job is they have probably 10 houses, and they will go to those 10 houses and take their data, vital statistics, and all the rest. The pilot study, as it were right now, because we can't cover all, we're just about in 3 local government areas to take out from there. They see these ones. Because why do we say so? You just said something. Some persons don't even, as you said, during the Ebola period, they don't even know about the text messages they are receiving. Till after the Ebola passed, none of them can remember the emergency lines that were sent to them by MTN and the communication people to their mobile phones. They don't care about them. They don't know about it. Knowing that, they will probably remember the Commissioner for Health from every corner of the state and say, call Dr. Parker, instead of calling the emergency line. You know that. So we need to expand beyond the technology that is here. What am I saying? Is it beyond or start from the grassroots? There are a lot of things we have left undone before technology.
Okay.
A lot of things we have left undone before technology. Such as this home-based care we used to have before. The community health workers, the sanitary inspectors. Those systems are all gone. We've come to technology. The phone technology is easy. How many people have phones? What's the percentage of Nigerians with telephones? And the percentage of them that know the value of the phone they have. The value of the phone they have. All that, they need to be taught about them. And that is where health should be made simpler. Should be made very simple. It's easy to get a health worker to see 3 households. And that is one thing I would want the private sector. It's an innovation as they are going to come and work with us with it.
Fantastic.
Yes.
Well, you know what, we're just going to take a quick break, and when we come back, the private sector will definitely be contributing to that. Well, we'll take a quick break, and CNBC Africa's discussion on the growing importance of healthcare in West Africa continues shortly. Do stay with us. Welcome back. If you're just joining us on the show, we are discussing regional challenges and trends in West Africa with a strong focus on the growing importance of health and healthcare in West African economies. Well, still with me are Dr. Sampson Parker. He's the Commissioner for Health in Rivers State. I also have Dr. Andrew Nevin. He is the Head of Strategy Consulting for PwC Africa based in Lagos. And also Dr. Muntaqa Umar-Sadiq. He is the CEO, Private Sector Health Alliance of Nigeria. Gentlemen, thank you for staying with us. And now, we have been talking a lot about improving the healthcare system in Nigeria and, of course, in West Africa. And just before the break, you were trying to make a very important point. And before we talk about what technology can do for us, how about using our foot soldiers, in a way, the health workers? And you say the private sector has a huge role to play in that. I'd like you to come in here, Dr. Muntaqa. You tell us, what's the private sector going to be doing in this regard?
Okay, just to build on his point, I believe that technology is an enabler. Okay, if you look at many other African countries that have been able to meet their health MDGs, they've been able to do that by spurring thousands of innovations. And so it is important to state that technology is just a small piece of the innovation ecosystem, right? Many countries have had process innovations or innovations in service delivery where, for example, they have thousands of community healthcare workers deployed to the front lines using various models. That is innovation. We've seen Ethiopia, for example, that have been able to use technology and apps to support their health workers, to collect data, to have on-the-spot data that helps to inform their strategy going forward. So that is key. Now, in terms of your question around how the private sector can be involved, I think there are 3 big areas. First, we need to recognize that more Nigerians seek care in the private sector than the public sector. That's first. The second is that the broader private sector exists. By that I mean the non-healthcare private sector, your financial institutions, your FMCG companies, your telcos. And these companies have the capabilities, the tools, the resources that the health sector can benefit from. So whether it is using Dangote Group's supply chain trucks to deliver drugs, or it is using the marketing capabilities of your financial institutions to disseminate the kinds of information that you need at the front line, or you use in health insurance or insurance companies' model of getting agents at the front lines to go to communities. These are private sector techniques that can help to address health sector challenges. In addition to that, I think that using the private sector to create that paradigm shift so that the health sector can go from being an economic drag to one that is a net contributor to economic growth is important. 40% of the people who come and meet me as CEO of the Alliance talk to me because they're interested in investment opportunities in the health sector. 1 in 8 jobs in the US is in the health sector. nearly $1 billion is being spent abroad on medical tourism. People going to Egypt, to UK, to seek care. Now, when they go to India, Egypt, UK, they go to the private sector in those countries. So how can we create that all-encompassing platform to respond to the high-quality needs of Nigerians within Nigeria? So I think that would be an important thing that the private sector can do to create your medical city, right? Whether it's your Lagos medical city or your Abuja medical city, that plays a role in stemming the tide of the capital flight going outwards. And I guess in a few months, the Alliance will be launching a Health Impact Investment Fund to address some of these challenges.
All right, so basically it's all about moving this from the hands of the government now, because there are state governments who rather say, they use this line, would like to make our state the medical hub. But basically, it still rests under the purview of the state government. They're the ones that want to drive this innovation. Fantastic. But while we wait, and hope that the state governments open up more to the private sector, let's take a look really I'm just going to focus more on what he said about using these village health workers. Because whether we like it or not, they're the ones who leave with the community. They live within the community. And having worked on certain documentaries on healthcare, trying to focus on what the MDGs or how far the MDGs have been achieved in Nigeria, I have visited very remote villages, really, where just a few people really still do have phones with them. And they have adopted a technique where you bring the healthcare to the doorsteps of these people. I'm talking about treating malaria, deworming children, because most of them really do not even have access to the primary healthcare centers where they are really, not equipped. Now, what's your take really on driving that technique, on having more health workers on ground to reach the people? Do you think we need to step up? Do you think we need to drop that? Or do you think we need to embrace technology more? What's your take on it?
Well, I lived in China for 10 years, and I went to China the first time in 1983. At that time, they still had the whole barefoot doctor system that they had put in place. And that's exactly what it did. It trained people not to be physicians, but at a certain level that they could deliver community care at the coal face throughout the country. And of course, through the 60s and 70s in China, you had a population that was more than 80% rural. So they proved the model can work. Unfortunately, China has gone backwards. And when I was in the medical system in China, people lamented the fact that they had lost that barefoot doctor system, and the newfound capitalism, in a sense, eroded that. So, if the political will was there, I'm sure the funds can be found to do it, because people know that the model works, that the value delivered for the amount of resources expended is tremendous on that way. So, if Nigeria would stand up and say we do that, I think they could do it at a cost that's not very high. And of course, you're now employing a lot of people all throughout the country to deliver something that's very important. So it would be a fantastic strategy, probably the highest return strategy that the country could adopt. But it couldn't necessarily be in the private sector. It's one of those things that has to still belong in the public sector, because at the end of the day, the healthcare system is going to be mixed. Some of it's going to be public, some of it's going to be private. Figuring out which parts go in the right place is very, very important.
This brings up a very important issue. It's a good thing you did mention, of course, it's not really solely a private sector business. It also has to do with the state government. Now, having traveled to a place like Jigawa, for instance, here in Nigeria, where the women prefer to have their babies in a certain way. Now, you're talking about really dealing with the ideologies and beliefs of most of these people, where they believe that only weak women who are weak, actually go to the hospitals to have babies. Now, of course, we're talking about improving healthcare in the West African region. We're talking about maternal healthcare, of course, for the mother and, of course, for their children as well. And they've come to realize that if we keep waiting, we're going to keep losing these mothers. And the state government took that upon themselves to say, you know what, let us go to them. We're open to it. Midwives are now being trained to deliver babies at home, and to deliver babies for these women squatting rather than lying down. My point being, that. Now, Dr. Parker, you just said something key. The barefoot doctors, of course, is very, very, very important. How do we ensure that this does not stop? How do we ensure that these people who do not have access to their phones, or who do not know how to really use these phones or even their computers, still get to leave and see another day? Yeah,
clearly, one thing we've all agreed here is that the importance of the private sector in healthcare delivery. So huge, so much importance. And there are things we all know, plan, we want to do this, we want to do that. is all open. Wonderful idea. Barefoot doctors. I've just talked about home-based healthcare scheme. Same thing. How is it going to be implemented? What are the challenges of these persons we are talking about? Logistics. We come to that again. Logistics. Now, how do we make sure that the logistics is available for them? The private sector model is available for them. They can provide this. How is the private sector coming in? Why should they come in at all? Why should Alhaji Dangote, instead of selling cement, be concerned about how people are getting treated about polio in the village and all that? Why should he be, instead of selling cement and getting profit? Is he doing that because of public, what do they call it, as charity, or he needs profit from it to be counted to him? Yes, he can do charity, corporate social responsibility in some way or the others, but that is not sustainable. What is the need for him? That's the next thing we ask. What is the need for the private sector? If they go into that, we need to answer that question if we want sustainability. Because why is the previous model, why is it failing? Funding. Key. Those barefoot doctors, they have families they need to take care of. Is it their remuneration enough for them? Those are questions we need to ask, because it's a very important part of healthcare, primary healthcare.
Doctor, it's a very important question we need to ask. I'm very happy you brought that up. Now, talking about funding, are we really doing enough to fund our health sector? Like, what percentage is even allocated to health in the budget to start with? Are we really taking it very serious? You know, here in Nigeria, are we really doing? I mean, China is currently increasing its spending on healthcare delivery and has been steadily, you know, upping it. I mean, biomedical research this time between 20 and about 25% a year.
Talking about the magnitude of the challenge in Nigeria, we have not started. We have not started, and if we rely on public sector funding, we'll go nowhere. We'll go nowhere. From experience, I'm telling you, we go nowhere. Funding should come from the people. That is why I will always support health insurance. Whether you like it or not, the people will keep spending out-of-pocket expenditure. All we're doing is the universal health coverage, you're talking about health insurance, is to organize the expenditure for them so they can do it. That is where I wanted to come with what is the need for the private sector. The private sector has a model. The health insurance people, they go. They don't send you phone that by phone message that you should come and do health, buy insurance. The insurance people, then they want to sell insurance to you. They come and meet you. Apart from calling you, they will come to you when you respond. They'll find a way of reaching you and telling you about the insurance. And that is what it is. We have to use that model. And if we now have a pool of funds to do all this, I take for example that it's already that we have a model in Rivers State with a Shell Corporation where a community is putting together 10,000 per annum. Now, let us assume that 1 million persons in Rivers State put together 10,000 for their healthcare needs in a year. That comes to how much? 10 billion. 10 billion. Just for healthcare, not infrastructure, just content. We will not be talking about funding for healthcare. But how many people will do that? If you look at how many people that are inside the health insurance, probably 1% now. So we need the private sector model to sell health insurance to the people. That healthcare is not about the government, it's about you. You don't wait for the government to eat. You don't wait for the government to buy food for you to eat. You buy food for yourself when you're hungry and you eat. When you're sick, you take care of your health. So it should shift. There should be a paradigm shift from waiting for government for these services, and there'll be a communication change to behavioral communication change so that you begin to think for yourself. You begin to think for yourself. Think what we should do. If 4 of us here contributed finance in any model at all, that shifts it from government, from anybody, to your own responsibility. Let's all be responsible for our health care. Government can give grants to support things. The private sector on their own, Dangote and his group and Sadiq here can organize themselves to support some specific areas.
So you're saying at the end of the day, it behoves on the individual to put health as a priority.
The community,
all right,
like the OBO model.
You're going to throw in something there?
Sure. I think I just wanted to sort of add to that. We have a mixed healthcare system in Nigeria. At the primary healthcare level, 2/3 of facilities are owned by the public sector.
Yes.
At the secondary level, it's the reverse. 2/3 owned by the private sector. And at the tertiary level, predominantly all owned by the public sector. I think there is a complementarity that we need to highlight. Government has that stewardship role, right? Supervisory role, planning and financing role. The private sector, at least through the Private Sector Health Alliance, is playing a role in complementing government's efforts to achieve the health MDGs, frankly, and beyond. Let me give a quick example. If you use polio as a case study, government at the time, led by Dr. Mohammed Ali Patti, engaged traditional institutions, innovation, who had, the following of the communities to do the sorts of advocacy that ensured that coverage rates of polio campaigns increased significantly, and we've seen record low numbers as a result. An example of government playing its role and seeing real results. He spoke about this earlier, but I think in Nigeria, we don't have a shortage of good policies. The issue we have is around delivery, is around implementation. And those are segments that the private sector can indeed play an important role, right, in sustainable ways.
Dr. Musa, let me just take you up on this before you go any further. Now, looking at the Human Development Index, released of course by the UNDP, most West African countries happen to fall under countries that have a low Human Development Index. And I mean, if you look at the health sector, the numbers are not it's not something you really want to smile about. Now, Ghana happens to be the only country, the only West African country that's actually under, would you call it, with a medium Human Development Index. But what's Ghana doing that we're not doing? You just said something we do not have a shortage of policies. But should I just throw that to you, Dr. Nevin? You just tell us, do you have any idea? Is there something we just need to hold on to, really, rather than just talk and look pretty on paper? Do you want to take that, Dr. Muta? Go ahead.
Sure. I think to answer that, there ought to be a recognition of our epidemiological and demographic transition as a country. Okay. Right? So Nigeria, over the next 20 years, will have an abundant youthful demographic. Mm-hmm. Now, depending on the decisions that we make in terms of investing in education and health, right, we will be able to reap the demographic dividends of this. Okay. Right? So human capital development is sort of an important, it can either be an asset or a curse, right? So the Arab Spring, for example, when you see unemployment, is sort of a big example of that. So I think it sort of speaks to the approach of investing in human capital development to complement the broader infrastructural investments in these countries.
You think that's what Ghana is doing? Go ahead.
Well, I think also, let's be really candid about it. One of the reasons Ghana's made such a progress is it's been the poster child for African development for the last 15 years. People like going to Ghana. Foreign organizations are prepared to put money behind public health campaigns, like being in Ghana. Nigeria has security concerns. It's a big, more complex country, so it hasn't been as attractive. So Ghana's got a lot of resources. It's used them quite wisely. On the other hand, as we know, in many areas, Nigeria has not always used the resources as wisely as it should. So, but it's great for Ghana that it's made that progress and sets up. There's no reason if Nigeria, in fact, even without external resources, Nigeria could do all of these things and surpass it. Not that we want everyone at the same level, but could do a very good job on some of these goals. But like many things, we know Nigeria's got to get better organized to do this. On that, so.
Well, now talking about funding.
Sorry, I just want to go back to the funding point, though. At the end of the day, people shouldn't be going bankrupt because of healthcare costs. Unfortunately, it happens in the United States. It doesn't happen in any other developed nation. There's well-developed health insurance systems. I'm Canadian. It's unheard of. It just isn't possible to go bankrupt for healthcare reasons. So at the end of the day, you want people covered by insurance. They then won't wait to go see the doctor. It won't be a catastrophic event financially for the family. So, as Dr. Parker said, there's a big interest in getting the numbers up. Now, there's a framework in place. I happen to think that the insurance works very well if you have the provider and the insurance working together, like some of the hospitals and HMOs are linked here in this country. But fortunately, I think that will drive itself. I think there's about 2 million people here covered under HMOs. But there's a big interest in the private sector in driving that. Of course, they're only going to drive it from the top of the pyramid maybe down to the middle of the pyramid, so the public sector funding has to work at the bottom. But I do think you're going to see, now that there's a framework in place for it, that's going to grow very, very rapidly. But from a small base, so it's going to take a while to cover enough of the population. Okay. Well, just, I'm rounding up in a bit. Let me just take a look at malaria. I mean, this is another major killer disease we have in West Africa, in Africa as a whole. The thing is, it's been around for a long time. And the question we keep asking, I had a conversation with you a few days ago, and you did mention, I talk about research, about how much we are really doing in terms of research. The fact that we still have to depend on the West, to help us put together a vaccine or a drug for something exactly endemic to the area where we stay or where we live as it is. Let's take a look at malaria. Why is it that in 2014 that ailment even comes up in the first place? I mean, it's been with us since forever. You think that by now we'd actually brought about, maybe put together technology or found a solution to eradicate it or curb it to the barest minimum. What's going on, Dr. Parker?
If we can just imagine how much malaria is costing Africa, we'll sit up and tackle it. I get worried and concerned when government come, government in, go, we treat malaria with kid gloves. And it just goes like that. It's just there. It's just like it's in the water. Drink it and go away, and it's okay. But every day, it's affecting our maternal mortality. It's affecting our productivity. It's affecting our growth rate. It's affecting our general health status. It's not about children dying. Some persons, combined with the poverty and malnutrition, is affecting our organs. Today we are talking about diabetes, we are talking about renal diseases, we are talking about other things, eye diseases and all the rest. One way or the other, malaria is implicated. And a disease like this, we have not looked at it as a continent, as governments, to tackle it frontally. It's not only it was in Europe. Malaria was in America. And they did it without vaccines. They didn't have vaccines to do it. What they did was physical control. First, physical control. Physical control of the environment. It's an organism. Where does it live? Let's rid the houses of this mosquito. And the mosquito will have nowhere to live and grow.
Important point. Now, Dr. Mukhtar, is it rocket science to actually just do what he said about talking about control? Is it really? I mean, in a way, I feel that the mosquitoes kind of improve on the technique in which the system or the style in which they actually transfer malaria to people, while the humans are actually being infected, just sit back and take it in and look for a better drug that will knock it off, as the days go by. Is it really rocket science to knock off and eradicate malaria in the first place?
Well, I think that we do have a complex, adaptive, and dynamic healthcare system as a foundation for wanting to eradicate this. I know that more recently the Ministry of Health has gone from controlling malaria to wanting to eliminate it. Absolutely. But I think that all of this is within the context of the health system we're talking about, which a disease like malaria, there are other interrelated segments. Hygiene is important when it comes to malaria. Infrastructure is important. So there are many other multisectoral linkages that mean that it will be challenging to sort of eliminate it in the short to long term.
Sorry.
So practically, we don't actually.
Let me.
But just for time, I really want you to say that. But just because of time, I'm going to just have to summarize what we've said so far. We've really said a whole lot today, starting from Ebola, talking about getting real about the issues we have in the region, the fact that it can be be tackled, the fact that the private sector has a huge role to play, of course, and the fact that the public sector I mean, their role is never ending. They're always going to be there. So just for us to round up, I'm going to be taking a final word from each person. If you could just summarize it in like a minute. I'm going to start from you, Dr. Nevin. If we're talking about setting our healthcare system straight in the West African region, not just Nigeria, what do we have to do? What should come at the top of the list?
Well, I think that we all know that the healthcare system is underperformed where it should be at Nigeria's level of development. As I said, I think for the public sector, they need to do just a couple of things that they do well. Something like malaria, the public sector has to take the lead. Public education around communicable, non-communicable diseases, the public sector has to take the lead. On the private sector, I'd like to see the private sector be bolder. What I'm finding with a lot of, say, foreign outside investors looking in, they all want to invest in the elite hospitals serving the upper tier. That's fine, but that's only a limited market, and it's not going to make a big difference overall to health here. What will make a difference to health are private sector solutions that go deeper into the pyramid. So I think if the public sector does a couple of things well and the private sector goes deeper in the pyramid, we'll make some real progress.
Fantastic. Now, Dr. Parker?
Well, I agree. Really, straight away, we need to know the difference between healthcare and Medicare. Let's leave the healthcare, basic healthcare, to the public sector. Medicare, public sector should not go near Medicare. Leave it for the private sector with all the financing models that should be comfortable with the people. Thank you.
Great. Dr. Mutar?
Sure. I think there are 4 important things. I think the first is around a focus on basic services. Right? So your malaria, your nutrition, vaccine, preventable diseases, scaling up basic services, that's first. I think the second is around prevention, right? And that speaks more to the non-communicable diseases, right? Your heart attack, diabetes, things like that. I think the third is around quality. The quality of care in our public and private facilities and the clinical governance to support that. And I think the fourth is the private sector, unlocking the market potential of the private health sector by engaging the private sector. I think all of these 4 things are the building blocks to ensure that as a country we play a role in saving at least 1 million lives of women and children in Nigeria every year.
I guess I've really strained your voice here today. Well, thank you for that fantastic summary. Well, thanks for being on the show. That's it on the CNBC special, looking at challenges and trends in West Africa with a strong focus on the growing importance of health and healthcare in West African economies. I'm Onyi Sunday. Thank you so much for watching.